So first of all, 2016 was a pretty big year as far as innovation in the medical world.
It was, yep. Every year we hope to see some good stuff, and we did. We'll go through the list.
What's interesting here is there are so many people who I have friends who have osteoporosis, and the one thing you're always told is you can never build backbone. You can just slow the erosion.
Right.
But there's something new on the horizon that may change that?
Yeah, exactly, Hoda. So basically, you think of bone as a living organ. You're constantly replacing it, building it, and losing it. And there has been another drug on the market for a number of years that just builds bone, doesn't just slow down the rate of loss, but it's very expensive. This is a medicine that they're hoping, there was a new drug application in the fall of last year. They're hoping for approval in March, which is a daily injection, which is going to purely build bone, meaning daily self-administered injection. Yes, I do have to say that. The results look fantastic in terms of reducing fracture in both the spine and in what we call non-vertebral areas in the hip. Don't know yet what the cost is going to be. I will say for you guys this, it's not going to be for everybody with osteoporosis as first-line therapy. There's still a great group of drugs that we use, usually first-line. This will most likely be reserved for people who have failed or those other medications are contraindicated for postmenopausal women with osteoporosis.
And you say around March it may pass FDA approval?
That's what they're hoping for, that it'll be approved by March of this year.
Let's talk about mammograms. They obviously save, tons of lives.
Yes.
But now you say they can also help prevent heart disease as well.
Or screen for heart disease. This was a study that came out in March, and we actually did that then. This is fantastic. This is basically taking advantage of an imaging test that all women have to undergo as it is, which is a mammogram, and getting basically like a twofer. So you do a mammogram, they do it digitally now, and what they're looking for, of course, are calcifications in the breast tissue. That's what the mammogram is for. But what they can also detect are little calcium deposits in the arteries of the breast. And what the study did was compared then women who had calcifications in the arteries of the breast and then something called a calcium score on a CAT scan of their heart. And they actually found that there was almost like a 70% correlation between the calcium in the breast and the calcium in the heart. And the point here, guys, is that the calcium in the heart is a predictor for heart disease. So you can be picking up, you basically are picking up incidentally. You say to the woman, you know what, we see calcification in your breast. You may want to go back to your healthcare provider and say, yes, follow this up with more testing. Do I have risk factors for heart disease? Can I intervene now with medication, et cetera, to prevent, the development of true heart disease?
Whenever you hear the word Alzheimer's, there's so many people who know people who are going through that, and everyone's desperate for some kind of treatment. There's something new on the horizon.
So I don't want to tout it as new and revolutionary. Rather, I would say that this is another therapy that had very nice, encouraging preliminary outcomes. It's a therapy called IVIG, which is basically not giving yourself, it's an infusion, an IV infusion that creates antibodies to amyloid, which is the buildup of that abnormal protein in Alzheimer's brains. I want to stop short of saying that that we have discovered a new treatment for Alzheimer's disease, but it's yet another one of those early studies that looks very promising that researchers are hoping with further studies will actually end up being something that could be useful for people who are in what we call the pre-dementia phase. So that's early cognitive impairment and make a difference before the disease becomes full-blown.
Do we know when this will be available?
No. And that's the other thing, because the earliest study that was done, that was actually reported in 2015, was done on 50 individuals. So we need a much larger study. We also need an extension study to see how well this could work.
And now we're talking supercomputers. And supercomputers can actually help diagnose.
Yes, this is amazing. This is about IBMs Watson. This computer has been having medical training since 2011.
Unbelievable.
This is what this computer does, and this is what any doctor in practice would love to have a Watson by his or her side. Basically, you can imagine millions of research articles are available, right? The database that we have to look through, we, meaning me, to make a clinical decision based on the science, make an evidence-based decision to treat a patient. Watson does that for you. You plug in all the patient information, all their clinical data. Watson goes through the whole database and says, this is the right treatment for the patient.
Why doesn't everyone have it?
Right, or this is the right diagnosis.
Is it expensive?
All good questions.
But by the way, probably less expensive than giving wrong diagnosis. diagnosis and going back.
Exactly.
There was just a report, I believe, December 28th, I want to say, my daughter's birthday, that IBM is now working with Cleveland Clinic to, all of this is basically to give more evidence-based guidance to physicians.
I feel bad.
That, to me,
Good to
is
hear.
the
Good
most
news.
exciting out of all of these.
Good. Well,
Dr. Azar, thanks so much.
Thanks.
For more medical breakthroughs, check out the current issue of Prevention Magazine.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.